is examination of seventh cranial. The seventh cranial is a facial nerve and it is a mixer nerve. It is having motor function and sensory function. Motor function is it is supplying the muscles of the face, and sensation is taste sensation, special senses. Taste sensation over the anterior tooth of the tongue. So these things you have to test for the facial nerve. First we go for the motor function of the facial nerve. So I told you it supplies the muscles of the face. So ask the subject to wrinkle the forehead. You wrinkle the forehead like this thing, do like this. Look at me, do like this. You do, again you do. Okay. Normal, do. Yeah. So you can see the wrinkling of the forehead, which is done by frontal belly of occipitofrontalis. Frontal belly of occipitofrontalis. Next, ask the subject to close his eyes tightly. Close your eyes tightly, okay? And you try to open the eyes. You put your finger, you try to open the eyes. Now you can feel the resistance by the muscle because the muscle is tightly closing the eye. What is the muscle? Orbicularis oculi. Orbicularis oculi, which is supplied by south cranial. Then, as the subject, if he knows to whistle, you can ask him to whistle. Okay, buccinator. The buccinator is a whistling muscle and it is supplied by the seventh cranial. You whistle. Okay, he is whistling. So buccinator is normal. And you can ask him to blow air with closed cheeks. You do like this. Okay. So this is also you can test for the buccinator muscle. Then you can ask the subject to tell E. Do this. E. This is orbicularis oris. Orbicularis oris, and here your orbicularis oculi. Then ask the subject to depress the lip. Do like this. Okay, this is depressor labial. Depressor labial. And here you can see another muscle. Do again. Normal. Do. You can see a muscle here. This muscle is called platysma and it is also supplied by the seventh cranial. So frontal belly of occipitofrontalis, orbicularis oculi, orbicularis oris, depressor labial, platysma. These are some of the muscles we are testing for facial nerve. Next we go for the sensory function of facial nerve. Sensory function of facial nerve we are testing the sensation, special sense over the tongue, the taste sensation over the tongue. Anterior two-thirds of the tongue, taste sensation is carried by sound cranial. Okay. Now ask the subject to put the tongue out, okay. And you have to test the anterior two-thirds of the tongue, and you will be provided with, okay, be normal. Before that you give instruction. What instructions you have to give is, you will be provided with a chart, okay, and with the basic taste sensation will be written, and the subject has to identify the taste sensation with his finger. Okay. The reason is the subject should not speak while testing the taste sensation. For that purpose we are providing the chart and the subject has to identify the taste sensation. So now you identify the taste sensation. This is sugar, salt, soap, bitter. I taste the taste and you have to identify what taste sensation. Now the taste sensations are provided in the form of solutions with the basic taste: sweet, salt, sour and bitter. You take the so dip it. Now this is the first test I am going to test. If you want, you can hold this tongue also. Put the tongue. Okay. Okay. You should not withdraw the tongue. Huh? Now you tell me what taste is. Sweet. Okay, show it here. Okay. He is telling sugar. Now I repeat. What taste? Sugar. Okay, good. So he is able to identify the taste sensation and ask the subject to go on gargle. Okay. Then you have to go for the next taste sensation: salt, sour, bitter. Keep the bitter at the last. start with sugar and end with bitter. And before testing each testing session, the subject has to go and he has to gargle the mouth and he has to come for the testing. So this is the taste sensation for the sound cranial. So for sound cranial, we have the motor component, muscles of the face, and taste sensation over the anterior pupil of the cut. And you can go for the corneal and conjunctival reflex again. Corneal and conjunctival reflex, why you are doing for sound cranial now? Because sound cranial is the efferent for the corneal and conjunctival reflex. You have to touch with the partner, subject will be closing the eyes. Closure of the eyes is done by orbicular optic, which is again supplied by sound cranial. Okay, thank you.